And let me know that you've begun the recording.
It's begun, Nancy.
Okay, thank you. So good afternoon. I'm Nancy Lee, the COVID-19 Systems Coordinator, and this is the information session for the COVID-19 Community Coordinators, CCC's, vaccination events and comprehensive health recovery initiative for tracks 2 and 3. And what that means is it's for both tracks. If you're going to do track 1 and 2, you'll learn about track 1 here. If you're only going to do track 2, you'll learn about that here. And if you're doing both tracks, that's track 3. This RFP is being issued by the Minnesota Department of Health, MDH, the Center for Health Equity. We will record this track 1 vaccination events and comprehensive health recovery initiative and place it on the webpage. I will refer to the request for proposal as an RFP, and I'll refer to the COVID-19 community coordinators as CCCs. Place any questions in the chat, and my colleagues will advise me at the end of the presentation about the questions so that the questions can be answered. The current COVID community coordinators will be called CCCs for the remainder of this discussion. So assisting me today will be Dai Vu, the CCC lead supervisor, to offer her insights, as well as Ms. Renika Evans will monitor the chat and at the end advise me of questions. Carly Lavallo is helping with technology and questions as well. And Christy Wynn is providing technical assistance. Thank you to all. I'd like to acknowledge that the land we live upon is the ancestral lands of the Dakota people. So please take a moment to recognize this fact through this acknowledgement. Today, this information session will cover the following information. First, the COVID Community Coordinator, the CCC legacy, which this new CCC RFP will build upon. We'll review the goal and objectives of this proposal and look at the proposal in detail. Then consider the application process and the instructions. And finally, questions will be answered at the end of the session. So I encourage you to place them in the chat. I'll first finish the presentation and then my colleagues will share each question. We'll do our best to provide answers today. However, the official answers will be posted on the FAQ page so that we can be sure to get all the necessary details included into the answer. Shown here are the MDH staff who are contract managers and will likely be assisting the newly funding CCC contractors. They provide guidance and mentoring and support for the CCC contractors to help assure that work plan goals are met. CCCs are community-based organizations that connect Minnesota's diverse communities to COVID testing, vaccination, and other resources. MDH believes it is essential to draw upon community strengths and trusted community networks to respond effectively to COVID-19 and to the long-standing health inequities made worse by the pandemic. So CCC's contract with the state to serve communities hit hardest by COVID-19, including communities of color, American Indian communities, LGBTQ plus communities, and Minnesotans with disabilities. And CCC support Minnesotans who need COVID-19 information specific to their communities, including in their languages. Coordinators help community members find and get critical resources to deal with health concerns as well as employment, food access, housing, rental, childcare, and legal rights. What COVID-19 vaccines are available, as well as how and when to get vaccinated, healthcare, and mental health resources. So this RFP will follow that legacy with two different paths that you have read about, and that's why you're here today. Track 1, vaccination events, and Track 2, comprehensive health recovery. So all of the people you see here on the screen are those persons who will support the new CCCs. So let's take a look at the elements of the request for proposal. So the goal of this proposal is to build upon the state's efforts to contain the COVID-19 pandemic, increase the vaccination rates, and enhance the health of all Minnesotans by focusing on equity in the communities that have experienced the greatest disparities. So this funding supports 1, the vaccination events, planning and hosting with emphasis on community engagement, or Track 2, the community-based programs that address long-term comprehensive health recovery and builds flexible, equitable health programs contributing to sustainable systems that will better withstand future shocks, or a combination of both. So services are to be provided in culturally relevant, linguistically appropriate ways for one or more of the communities that will be described. Leveraging community strengths and trusted community networks is essential to respond to COVID-19 and the longstanding health inequities that have been exacerbated. And the state encourages applicants to use a trauma-informed lens for their work. The CCCs will work with state and local emergency preparedness staff, clinics, federally qualified health centers, epidemiologists, and the local and tribal public health. Programs will promote understanding of the importance of COVID-19 vaccination and the hosting of multiple COVID-19 vaccination events by incorporating community engagement strategies. And for Track 2, the comprehensive health recovery, the needs of communities to recover from COVID-19, from this pandemic, extend beyond immediate physical health concerns to include the social determinants of health, other health equity issues. And so the awarded CCCs will help advance health equity by creating community program resources needed to address these broader needs, and by advocating for resources to address systemic needs that are not adequately met by existing resources. So the recovery approach should be holistic, recognizing people's complex identities and engaging with family, neighborhood, and/or community contexts in which our communities live. So first, I want to say that this is a competitive process, and all contractors, existing contractors, are eligible, along with other entities that may not have worked with us before. As you can see here, local not-for-profits, tribal nations, faith-based organizations, human and social service organizations, healthcare organizations, for-profit businesses, transportation agencies, trade associations, and others. So this is a very open process. If your organization is not recognized as a formal organization, you can still apply with a fiscal agent. And we encourage partnerships and collaborative proposals. Those are certainly welcome. Now, priority, these are our core values and approaches. The priority is given to organizations led and staffed by communities most disproportionately impacted. So if your organization, its board and its staff, 51% are communities most disproportionately impacted, that's great. That's an area of priority. Also, we want to know that you're based locally, living in the area where you claim that you will be serving. That you have a record of community engagement and leadership that's rooted in health equity and racial equity. That you'll leverage trauma-informed, holistic approaches to well-being, because as you know, this pandemic has caused a lot of emotional stress. So any programs that you propose need to keep into consideration that as you approach people, that they have left within them the stress and trauma from what they've experienced these last 2 years. And lastly, priority given to those that are focused on the intersection of identities. So applicants, you need to clearly demonstrate in your literature that you're serving one or more people, and you're certainly encouraged to offer programming that serves the intersection among populations. For example, Latinx who are also have disabilities, or American Indians who are also LGBTQ. So those are things that we're looking for. These are the specific communities that are reported to have been most disproportionately impacted, and that we will have a focus on: African American, African immigrant, American Indian, Asian American Pacific Islanders, Latinx, LGBTQ+, persons with disabilities, as well as other intersecting demographics, incarcerated, low income, older adults or elders, migrant workers, new immigrant and refugees, youth or unsheltered and homeless. But I do want to say, this is not limited to the above. So if you want to suggest another community that you believe has been disproportionately impacted, and you can provide that information in your proposal, who else might you think about serving? Let us know. So for track one, the focus is on vaccination events. I'd like you to do me a favor right now. When you, since you're here today, and we're going to be focusing both on tracks 2 or both, raise your hand and let me know how many of you here are interested in applying for both tracks. And use the emotion reaction. Raise your hand so my colleagues can get a count, and please leave your hand up for at least 30 seconds. They'll let you know when to put your hand down. We just would like to take an idea of how many of you are going to go forward with both tracks. So for track 1, we would look for you to host 2+ events per month, to spend at least 50% of your funding on those vaccination events. And of course, you'll be coordinating with local public health and medical providers, tribal health, and others. You need to do your planning, incorporating social vulnerability index, and we have in the appendix of the RFP information about that. You'll be doing registration for COVID-19 appointments. If appropriate and you would like to, you'll staff a hotline. You'll provide COVID-19 health education, cultural and linguistically specific vaccine health education. You'll be publicizing and mobilizing the community for these events. and creating an effective communication method and networks. Then here are the items for the deliverables for track 2. Now, as you can see, this focuses on a number of different elements. Addressing the social determinants of health, there are some examples here of long COVID, chronic health conditions, food access, incarceration, mental health, child care, transportation, many other things that you might be looking at. You're sponsoring no-cost programs or workshops or offering resources that address the full person, not just in terms of health, but in terms of all of the elements of their lives. You'll work with partners to address community needs related to COVID-19. Advocate for additional resources if you see that there's an unmet need to be addressed. Investigate community concerns and share your findings with MDH. Maybe you'll do a hotline as well to educate and provide resource referral. And then, of course, referrals to any local public health or other resources. So we believe in this idea of health equity and how the whole person has to be considered. And so the recovery approach that the CCCs will use will be holistic in terms of recognizing people's complex identities and, again, engaging with the family, neighborhood, and community context. So I want to say that there's a 2-year funding range and a 2-year timeline. So all of your documentation will sum up into 2 years. The 2-year funding range is $100,000 to $500,000. And I want to just say, in other words, you can think of it as $50,000 per year if you're going at the lower end, $100,000, or $250,000 a year if you were at the upper range. That's the max. We will not be going beyond $500. Not every organization will ask for the full amount, so you can ask for less than $100,000. We realize that some organizations may wish to request less than the $50,000 per year, and that's fine. And there's no advantage to whether you apply for 1 track or 2 tracks. It's still going to be the same range. So, and if you're doing track 1, we just want to emphasize that you need to be spending at least 50% of your funds on the vaccination events themselves. And there are no matches to this. This is of course, you may have other programs that complement this. That's all well and good, but we don't require that you do so. But you can see this range allows for MDH to imagine supporting at least 30 or more organizations. And that's our key goal, is to get as many organizations around the entire state from as many of the communities that have been disproportionately impacted as we can. I will be reminding you of this throughout, so the application is due on February 28th at 11:59 p.m. So now we'll talk a little bit about track 1, the vaccination events, with some hints from Dai Vu, the CCC lead supervisor. Dai, are you available?
Yes, thank you, Miss Nancy. Hi, everyone. Glad to see everyone here. So for track one would be mostly to host vaccination events. As you can imagine, the vaccines are still not getting to the arms of many of our communities that need it, and we need your help. And that's what the track one truly is about. So as potential applicants for track one, the goal of it will be to build a really strong team with people who understand about community engagement, about the needs of the community, being able to work with partners to identify areas where or pockets of communities that may not have access, or maybe have access, but there are other barriers that might need because of hesitancy, maybe a fear for vaccination. So really doing community outreach and community engagement as well. In order to put together a vaccine event, it requires the following really steps. One, to again, after you build a team, to identify the partner and the site that you want to do it at, and then you can also identify a medical team, and MDH can help with that. We will be contracting with medical teams that we will sort of match make with our potential CCCs, and then be able on the day of to help with registration, to help with interpretation, but really to be that host to make sure that everyone that comes through those doors are feeling respected, have a good experience, and then be able to have the questions answered. I know that the best events have had other support services, and when the people are there, they're asking if they need help with housing, they need help with transportation, or else they need help with health insurance. So really, when someone comes through those doors, they have other needs other than the vaccine. So they do truly appreciate other wraparound services as well. And then after the event's done, to really help to work with our team here to report that data, and through the through data, but through pictures and stories, that really effectively paints a picture of what we are doing out there as a team. So some tips: it takes about 2 weeks to identify a medical partner, but it takes about 3 to 4 weeks to really plan an event. So that's it depends on what's the staff capacity. Like Miss Nancy said, there's expectation to do twice a month for these events. And so if you have more capacity, definitely can do more. But if you have less capacity, it can also help you with that as well. Because MDH comes with a whole team of community vax colleagues in addition to RCC leads to help plan and give tips along the way as well. Back to you, Miss Nancy.
Thank you for that comprehensive set of information that I'm sure will be helpful to our prospective applicants, particularly those who may not have engaged in this particular activity to this extent before. So knowing that you have support from Di's team is really critical, and we're here for you. So if you're applying for track two, what's called the Comprehensive Health Recovery, I'd like to share some tips with you and some hints about what this is about. First of all, this is about, again, the recovery from COVID. So everything should be built on that factor for what's happening here in Minnesota. So consider many elements, including the social determinants of health, chronic health conditions, mental health supports, persons who are incarcerated, what might their supports be, transportation, issues around long COVID. And I'd like to share with you some statistics to pique your interest in. For instance, 38% of households across the nation report facing serious financial problems in the months following because of COVID. So are there programs that you might craft to help Minnesotans who have found themselves in financial hardship? The CDC says 50% plus of COVID-19 survivors who they've sampled report depression symptoms months after recovery. Also, we can see here that because of long COVID, individuals may have physical symptoms, or they may have forgetfulness, or Their taste buds may not be right. There are a lot of elements of long COVID that are problematic. The Human Rights Campaign reports that Latinx LGBTQ people are more likely to report work hours have been reduced and they've lost their jobs due to COVID-19. And they were more likely to have taken unpaid leave during the pandemic. What might be done to support them and move them towards recovery? When you think about the mask debate in schools, there are medically fragile children that can't go to school or play with other children because of their health conditions. Is there something that might be done to help support those families, those children? Let's say there are adults who are immunocompromised due to some condition, and so they're left behind by friends who are moving on with their lives, who are free to socialize in a vaccinated bubble. But the friends don't want to risk infecting the person who is immunocompromised. That person is pretty lonely. How can they be supported? At the time the CDC eviction ban expired, remember when no one could be evicted from their housing? At the time it expired, 27% of renters nationally reported serious problems still paying their rent, and they likely lost their housing. How might you help them find housing? It's believed that 69% of children in K through 12 fell behind in learning because of COVID. What can be done to support those families or children? Also, despite significant efforts since the start of COVID-19 to help expand Americans' internet access, 23% of households with children still report either having serious problems with their internet connection to do homework or to find jobs or to do their jobs. What is it that can move them to have better access to these resources? So while you can't pay rent for someone, how can you help them find housing? How can you help people get to employment? What are the transportation needs that you might be able to support? So these are all areas that encompass beyond purely health conditions, that look at social determinants of health. And it's for you to say, here's what my organization has the capacity to do. Here's a program we think will really help people recover from what COVID-19 pandemic has done to us. So let us look at the submission form and what that process is like. I'm going to show you some select questions, not all of the questions from the submission form. The submission form is the first step in your process, laying out the background of your organization, and it will be sharing your vision for your proposal. So this section allows you to indicate the composition of your organization internally. As we said, there's priority that would be given to an organization that's led by people of color, American Indians, individuals with disabilities, and or LGBTQ individuals. So you check mark whichever one. And then you also tell us how your organization interacts with the community. How are you sharing power? How are they incorporated into how you put together your programs or other business? Another set of select questions: which is your primary community that you'll engage? Now, this is talking about who you intentionally have designed your organization's services for. Not that you're coming here, oh, we can get some funding, let's choose this one, that one. No, if your organization only reaches small amounts of a particular community beyond your target, but they're not the primary audience, when designing your services and outreach, please do not check those boxes. And indicate any other relevant demographics of the target population that you will intentionally reach through this proposal. And we will look at some of these groupings in a few moments. This, again, in the initial submission form, we ask you to estimate your community reach. You choose track, if you're only here for track 2, you would choose that. If you're here for both, then you choose track 1 and 2 and enter the data. So we've got 2 different sections, one for year 1, year 2, and for 2 tracks, year 1 and year 2. Please fill out both completely. The numbers that you enter here should be fairly close to what you will enter into your final work plan. And the template has formulas embedded into the document. As you can see, there will be totals at the bottom. So please don't overwrite those sections. Also, we ask that you estimate the budget. You, again, will fill out track 1, year 1, track 1, year 2, track 2, year 1, track 2, year 2. So if you're doing it for both, if you're combining, you would fill out all. Again, the total, there's a total embedded at the bottom, so be sure not to overwrite that. You want this amount to be as clear, as closely identified as you can so that it'll meet your final budget. So once the organization's background information and estimated community reach and estimated budgets are completed, then you're ready for the last 2 steps. So you'll note that there's an affirmation statement where you indicate that you've read and will implement the state's vaccination and testing policy for your staff. This is important. We want you and your staff to be safe because you are going out and meeting people who may have been exposed to the virus, and they're going in for vaccinations or whatnot. So please carefully read that and be able to set up policies and procedures to be able to fulfill that area. Then you'll read down here carefully what the next steps are for going forward with the proposal. And we will send you a confirmation email after you click submit. That should come to you within about an hour. And you must follow the steps in that email to download the work plan and the budget and return them all by 11:59 p.m. on February 28th. So remember, the confirmation email is not the full proposal submission. This isn't it. You need to get to the work plan and the budget. If for any reason after you've checked your junk and spam box and you still don't see the confirmation email, go ahead and complete your supplemental materials, your work plan and your budget, and mail them anyway. Mail them to us at the email address. It will be shown here, the health.covid.outreach@state.mn.us. It's listed throughout the RFP. So you'll go ahead and mail it to us, indicating in your email that you submitted the online form but did not receive a confirmation email, and we'll follow up with you. So our next preview will be the documents related to the second part of the application process. So you submitted the first part. That's the proposal form with your background information. Now it's time to complete the 2-year work plan and the 2-year budget. So here's just a few pieces from the 2-year project work plan. And you can see here, please note the colors that I've chosen of these groups, because that's going to help you when we look at the next slide, which will be an example. So the blue here, we've chosen African American, LGBTQ, and Asian. The green, we chose incarcerated. So we strongly recommend that you use this work plan because it's already set up to get all of your information. You choose whether you're going to do track 1 or 2, or you'll choose both. The communities and demographics are numbers because the work plan, you will need to reference those numbers. That's why I'm highlighting them for you right now. Also, once you finalize your documents, into the official budget request and the number of unduplicated persons that you will serve. So once you finish your full work plan, and we'll look at other parts and the full budget, we ask that you put the final numbers here on the front page. Again, it's 2 years, funding range $100,000 to $500,000. You don't have to go for it all. And not every organization will ask for the full amount, and it's no advantage or disadvantage whether you do that or not. So thank you for that. And this is an example for track 1. Yesterday, I didn't get to this fully, so I want you to notice, again, that 10 spoke to incarcerated persons. So if, for instance, you were doing the vaccination events, so you might title it Promoting Vaccination Justice. You enter the number from above of the community of focus, number 10, green, the incarcerated persons. The targeted need, vaccination events for persons who are incarcerated in the quartile 1 of the SVI, Social Vulnerability Index. Remember, we have pointed you to that as a resource. And you're going for your track 1. Sorry, it says track 2, but track 1 is vaccination. So you give a description of the activities during first 6 months, create collaboration with the county jail to lead bi-monthly discussions with up to 10 incarcerated persons about vaccine safety, plus hosting the vaccination events twice a month for a balance of 18 months. Twice or more, 50% of your funding going for those vaccination events. The timeline is 18 months. You'll have key staff that you'll list here. You'll estimate your reach. Well, if in the first year you have 6 months that you're working with the county jail to make sure that you set up the policies and protocols for your staff to get in and out, for them to have their background checked, to make sure they can get in safely, they understand what's needed to keep themselves safe, then you'll have 6 months times 2 events per month, times 10 incarcerated persons will equal 120 unduplicated persons. Then for year 2, you'll estimate, okay, we're up and running. Now we have 12 months times 2, times 10, 240 persons. So that's kind of how you're going to be figuring out your work plan for everything that's here. Let's go to example 2. Again, we give it an activity title. You're focused on youth this time. Youth, mind, body, and soul wellness support. Up above, we had the blue, that was the African American, LGBTQ, and Asian and Pacific Islanders. You're looking at mental health. This is track 2. You have a cohort of 10 youth aged 12 to 16 to discuss issues that surfaced due to the pandemic that related to loss and grief. So you're offering them peer support, adult mentorship, and mental health counseling. Every 8 weeks, you'll do a cohort per quarter, an 8-week cohort per quarter. And you'll make sure you have staff and mental health professionals as needed. So 4 quarters a year times 10 youth, that's 40 persons for year 1. The same thing for year 2. And then the 2-year budget. There will be 2 sections to the budget. I'm just giving you a sample of what it might look like. You'll download this from the RFP. You'll also download a budget guide that will tell you the allowable expenses and the unallowable expenses. So you're strongly encouraged to use the budget template, which is an Excel document. It will have, once again, formulas, and you don't want to overwrite those formulas. And you can see here vaccine-related expenses in a 2-year budget. You're entering data for 2 years on the budget sheet. Then there's a separate section for track 2 on the comprehensive health recovery. And I do want to highlight that we've listed in here among your supplies is PPE. If you are doing your budget, be sure to include the personal protection equipment for your staff, and you may also be getting some for community members, but it's really important that your staff are protected as they're working in this virus environment. Okay, and again, we know that not everyone is going to apply for the full amounts. That's fine. And if you want to apply for less than $100,000, that's fine too. There's no advantage or disadvantage either way. There's also a section in the RFP that says attachments. Please go there to review the standard contract template. It will tell you about insurance requirements, procurement laws, and things of that nature. So it's very important that whomever is working in your finance area understands that contract completely. So now the proposal evaluation, I just want to share with you that to the extent possible, the review committee members will represent communities that we previously defined, those from the communities most disproportionately impacted. They're going to read through each application, taking into account this criteria: history, experience, and qualifications. Could be 0 to 10 points. Community engagement ideas and the work plan, the 0 to 30 points. Alignment with the state needs, 0 to 20 points. Budget and costing, 0 to 20. And equity, diversity, and inclusion, 0 to 20. So they're looking at how well is the proposal designed to meet the needs of the community that has been listed to receive services. So they'll be considering the social vulnerability index, they'll be considering social determinants of health, as well as the current vaccination rate, the community's access to information, the size of the community, the language needs, the geographic area. So responders will be selected based on their ability to engage communities with culturally relevant, linguistically appropriate, and timely activities to increase community understanding of and engagement around COVID-19. So now what? Complete the proposal submission form. That's the first thing, and click submit. You can expect to receive a confirmation email within 1 hour. Then you download all of your docs, the work plan and budget. Finish those up during the rest of the month. When you get all of those, then you'll hit reply to the email, because it'll have that submission information at the bottom. And you're going to attach the work plan and budget and then email it to the health.covid outreach. All of this has to be done on or before 11:59 on February 28th. And please remember that responses received after the deadline will not be considered, even if errors or delays were caused by issues outside of your control. So writing your proposal early and sending it as soon as possible is the best thing you can do. So during the months of March through April, this is how we'll be looking at the final selection of awardees. During that March through April period, applications will be assigned to the review team who are carefully reading them based on what we just looked at. At the end of that time period, final decisions will be made about awards. We're looking for them to represent a range of geographic areas, the communities who are most disproportionately impacted, and prioritizing entities that are led by our focus groups. And you should note that if MDH concludes it lacks proposals reaching one of its priority communities, the submission process may be reopened and submissions will be reviewed on a rolling basis until funds are used. So in the meantime, after you apply, please do not contact the state to inquire about the status of the response. Just move forward with either you can review this documentation and just know that whatever you have submitted, we will be reviewing and let you know about it. What will happen is that sometime in May, we anticipate sending out notifications to those who are selected and begin the negotiations, and then contracts begin on July 1. So here we'd like to offer you some resources that could help inform your proposal. There are hyperlinks in the RFP to all of these resources, so please use them to your benefit. And finally, if you still have questions after this discussion, feel free to send them to our email. If you have a question, it's likely that others will have it. So right now, these are things I want to make sure you don't forget. The full proposal application is due, say it aloud with me, February 28th at 11:59 p.m. So that's the main thing there. And so now is the time for questions, and please note that the answers given during this information session are preliminary. Once we review the questions more carefully, the official answers will be found on the FAQ page, and that link is being placed in the chat right now. And so, Ms. Renika, will you begin reading the questions, and we'll see how many we can get through.
Okay, thank you. The first question is a track and format question. Is track 1 and track 2 50% and 50%?
No, we're not suggesting that. If you're applying for both tracks, you determine the amount that is most appropriate in each track, if I'm understanding the question.
The next question is there a required match?
No, we have no match requirement.
The next question is a funding question. Can this funding be used for incentives for these vaccinations or vaccination events?
Not incentives. No.
The next one is the partnership question. Can the grant application be submitted by 2 organizations who work together on this project?
Yes, but one of you must be listed as the primary. Of course, that organization's leadership will sign the contracts, and then the 2 of you determine how the funding is appropriately split.
The next question, work plan goals. Is there a minimum number of people reached that is required for track 2?
No, you propose to us what you think makes sense for whatever the program or workshop. And of course, the funding that you're requesting needs to look like it is efficiently reaching the appropriate number of people.
And then what are the implications if you do not reach the goals despite efforts?
Well, theoretically, you should be in continuous discussion with the CCC lead who is working to support you and throughout this time period. So the two of you will be looking at where you are. Maybe it's on a quarterly basis, you know, and figuring out how to readjust your work plan if needed. And then if we need to readjust the budget as we look towards the end, we may also do that.
The next question is community engagement. Since $5 million is a drop in the ocean for such a diverse community with lots of needs in dealing with COVID-19 efforts, which office can we discuss that with as CCC organization?
Well, that's a good one. I would say your legislators, you know, we have, as the pandemic goes on and you know, there's a lot of discussion about whether it's becoming an endemic. And so it's really not so, I'm going to use the word unique anymore. Obviously, funding has come from many sources over the last 2 years, CDC, FEMA, philanthropy, etc. So really it's about, you know, whether the legislators, you know, provide the support for these kinds of programs and recognize the importance of them.
Thank you. The next question is a funding question. What is the rationale behind allotting points for the budget?
Because the budget offers a view of how well the dollars are being spent for the activity that is proposed in any situation, whether it's with philanthropy or just in general. You need to look at how well a organization has put together their financial patterns. So it's just a matter of making sure that the dollars are aligned with whatever the activities are suggested. Mm-hmm. And, you know, as you can imagine, your organization, MDH, every organization, when we're using these dollars that are provided by another entity, they are looking for oversight that's appropriate and efficient with the use of dollars.
The next one is a funding question. I'm trying to read, they keep moving. Would a proposal with a smaller budget be scored more than one with a higher funding request?
No, there's no disadvantage or advantage based on the amount that you're requesting. The key is, who are you serving and how well does your proposal explain that, and the goals or the ability to really serve that community. So no, there's no disadvantage or advantage based on the amount you ask for.
Can an institution on learning apply for this, like a small college?
I would say a small college. Ooh. Well, I guess it depends on how small, because most college institutions, you know, have a significant funding already. I will have to check with our contracts department on that, and that will be listed in the FAQ.
Is it possible to apply for one category, such as transportation only?
Yes.
If choosing track two, will CCCs be able to focus predominantly on an issue such as food under the umbrella of social vulnerabilities?
If there's a program that you want to look at that helps to get people to access food support, understanding, yes, you could focus on that, but you're not buying the food for people. So that's where you need to review the allowable and unallowable expenses in the budget guide.
When would this recording be available to the audience?
We expect this session to be available either the end of today or first thing in the morning. Both yesterday's and today's recording.
Also, will CCCs continue to have access to Minnesota Department of Health subcontractors for media medical providers, for vaccine services, testing services, and etc.?
This is focused on vaccination, not testing. And I'd like Di to answer what the connections will be with those types of entities. Di?
Ms. Nancy, can you please repeat that question?
Renika, would you repeat the question?
I will. Also, will CCCs continue to have access to Minnesota Department of Health subcontractors for media, medical providers, for vaccine services, testing services, and etc.?
Yes, I thank you, Ms. Renika. Yes, Joanna, CCCs will continue to have access to what MDH may have offered, which will be community engagement, diverse media. We, as you already know, that these are contractors on other teams, and so we would just very respectfully approach the other contract managers to see what may be in their work plan. But in terms of support in other ways, yes, definitely. The testing right now is unclear what that may look like post June of 2022. But whatever we have access, and of course, we look to you as community leaders to lead and to advise us on what is needed. And then we can always raise and advocate for these services that we may not have access to. Thank you.
The next question, will data evaluations require the same reporting process as currently in place?
Who asked that question? We will likely be reviewing the reporting and evaluation elements because we've learned from this year. And so we want to be mindful of how can we make that as efficient but informative as possible. So I would not necessarily expect the same exact things, but we're looking into that. So stay tuned.
Are there restrictions for doing voter engagement types of activities with these funds?
I think that's going to be something to be careful about. So we will double check and have that in the FAQ.
As part of track one, can we choose not to host vaccine events, but do vaccine education, engagement, and outreach, and other things allowed in track one?
No, it's vaccination events. And I'm also going to ask Di to chime in on this.
Thank you, Ms. Nancy. So, in response to this question, we currently have community engagement contractors as well as diverse media to assist in these roles, which will be doing vaccine education, outreach, and other raising awareness, overcoming hesitancy. So what we're looking for track one is to have partners who understand the needs and where the communities are located to increase vaccination and to actually do the vaccination itself, in essence, be an extension of MDH to make sure that people are getting vaccinated.
And so we are at the end of our time, and I want to be respectful of everyone who came today, and thank you so much. We know that there may be more questions. All of the questions will be pulled and answered in our FAQ, and we will let you, and the FAQ link has been placed in the chat, so that should be available to you. Because we're compiling from both of the sessions, you can look for the FAQ either at the latest by Friday, but I'm going to try to have it up on Thursday. So thank you everyone for joining us today. Appreciate your interest in this RFP and look forward in the future to meeting some of you. Have a good day. Bye now.